We found that as of 2024, an estimated 2 million Ontarians, or about 12% of the population, did not have a primary care provider. Our audit found that the Ministry of Health and Ontario Health did not consistently have processes in place to plan or oversee programs and initiatives that are intended to improve patients' access to primary care providers. Our audit found that the province's centralized matching program, called Healthcare Connect, has not kept up with demand. The number of Ontarians on the wait list as of January 2025 represented only 11% of the estimated number of Ontarians in need of a family practitioner. On Healthcare Connect, there were more than 108,000 people waiting for more than a year to be matched with a doctor. We also noted that there was a failure to coordinate physician recruitment at the provincial level, which has resulted in a fragmented and competitive approach to recruitment across the province. We examined the government's oversight of physician billings. We found that the ministry lacks a modernized payment system and is not using data analytics to detect potentially inappropriate physician billing. The Ministry of Health paid $19.5 billion to roughly 35,000 physicians in 2024-25 through the Ontario Health Insurance Plan, or OHIP system. The OHIP system, which has been in use since the 80s, cannot automatically flag potentially abnormal billings for further investigation. We found that a system modernization initiative announced in 2023 has been delayed and is awaiting approval by the government. We observed that the ministry relies primarily on tips and complaints to trigger post-payment audits. We observed that only 8 staff conduct post-payment audits, the same number as they did in 2017. In a 2024 analysis, the Ministry of Health noted that between 3 to 5% of fee-for-service claims that they reviewed had potential anomalies. And we calculated, using their percentage and the $13.3 billion in fee-for-service payments made that last year, that approximately $400 to $665 million could have these potential anomalies. Our analysis of fee-for-service billing data between 2021 and 2024 found numerous examples of potentially high-risk billings that were not audited by the ministry. This included physicians billing more than 24 hours a day, over 365 days in a year, billing for seeing more than 100 patients in a day, and where their overall billing was significantly higher than their peers. We recommended that the ministry utilize data analytic tools to flag these and other high-risk payments for review. The Ministry of Health agreed with all 19 of our recommendations. Next is a Supply Ontario PPE audit. Our audit noted that between 2021-22 and 2024-25, over 1 billion PPE items valued at approximately $1.4 billion were written off. At current rate of use, more of the stockpile is projected to expire in the coming years. We found that the province and Supply Ontario delayed disposing of unsafe inventory, or unusable inventory, Between 2023 and 25, they disposed of 780 million units through incineration. We made 6 recommendations which Supply Ontario agreed with, including setting up an integrated inventory management system to track and report on PPE on a timely basis.